Hi, my name is Debra Sewell. I am the Curriculum Director at Texas School for the Blind and Visually Impaired. And today we're going to talk about evaluation and instruction of students with visual impairments. So how do we get started with this process? Here's a graphic explaining that it's sort of a circular event. You do your evaluation, you write your IEPs, you provide instruction on those IEPs, and then you do reevaluation to see where your student is functioning, and then you start the process over again. The evaluation sequence that we're going to talk about is obtaining the I report, doing your functional vision evaluation and your learning media assessment. Then other evaluations will be done by other people, the SLP and the PT and the OT, and sometimes diagnosticians. And so when you start this process in this sequence, you need to review the previous information, including previous eye reports, what devices they might be using, the lighting they might need, determining the test that you're going to use. And it's really important that you establish rapport with students before you start evaluating them. So let's talk a little bit about the FIE. What in the world is an FIE? A full and individual evaluation is required for initial eligibility and reevaluation for continued eligibility. It has to include a comprehensive review of student progress in all areas related to the suspected disability. For students with visual impairments, all areas of the expanded core curriculum should also be included in the FIE. Probably the FIE is the most important element in the special ed process, as it is central in determining eligibility, calculating present levels of academic and functional performance, and developing the IEP. If you Google FIE or full and individual evaluation, you can find a lot of information out there for forms and processes. One of the websites I like is texasprojectfirst.org. It's just all together, TEXASPROJECT first.org. And another valuable website that has good information is the TCASE website, TCASE.org. So those are just some additional resources that you might want to use. A little bit more information about the full and individual evaluation with legislation. What should the full and individual initial evaluation consist of? The purpose of the FIE is twofold. It's to determine whether or not a child is a child with a disability, and if so, to determine the content of the child's IEP. And you can see there's a reference to the Code of Federal Regulations, and you can also Google that particular code, and it'll give you some further information about the FIE. So in the case of initial evaluation, the team must determine first whether the child meets eligibility as a child with a visual impairment, and then whether by reason of that visual impairment, the child will need special education and related services. Just a little bit more information about the FIE. The ARD committee should determine what evaluations are going to be needed to appropriately determine continued eligibility as a student with a visual impairment, and then they will develop the student's present level of academic achievement and functional performance. If a student continues to meet eligibility as a student with a visual, or criteria as a student with a visual impairment, the district should have a systematic process to ensure that all areas are listed that are listed in the Texas Education Code have been considered, including all areas of the ECC. And a COMS needs to be a member of the committee that determines what evaluations are going to be used and needed. Texas Administrative Code tells us that 4 specific evaluations must occur for initial evaluation of eligibility as a student with a visual impairment. Those 4 evaluations are a doctor's exam, report, a functional vision evaluation, a learning media assessment, and an O&M evaluation. The Texas Education Code 30.002 delineates more information about education for students with visual impairment. And what it tells us is that a requirement is the evaluation of the visual impairment itself and instruction in the expanded core curriculum. Functional blindness used to be in the old laws and rules, but it is no longer being, that term is no longer being used. There is a benefits of Braille document that is now being used instead of the term functional blindness. If you Google benefits of Braille, it will take you to some information that is useful for trying to determine if Braille is going to be beneficial for each student, and that information needs to be shared with family and staff members. So let's talk a little bit about the role of the teacher of students with visual impairment in the evaluation process. First of all, the TSVI needs to obtain the I report and look over that I report and make sure you understand it. And if you don't understand it, then you need to consult with the eye doctor and discuss any issues that you think are problematic. You need to consult with the family. You need to do observation and collaboration. Observation and collaboration are huge and really need to occur for all of our students that we're evaluating. Then you do the functional vision evaluation and the learning media assessment. Then after all of that is done, you refer for other evaluations, such as a low vision evaluation, an occupational therapy eval, an eval by the physical therapist or the speech language pathologist. There's a new book we're going to talk about in a little while that talks about the functional vision evaluation, and it is called Essential Tools of the Trade. And that book also has a lot of observation forms in it that you could use to complete that part of this process. The role of the TVI continues. So after you have done your functional vision and learning media assessments, you need to consult with the school staff to share information about those 2 evaluations before the other evaluations are done, because those will inform the diagnostician, the classroom teachers, the related service providers, and any paraeducators about what kinds of modifications that your student with visual impairment might need, like lighting conditions or use of a low vision device. So it's really important that you have consultations with the school staff before they do their evaluations. And then after all of that is done, you do your ECC evaluations. Well, in all actuality, these probably happen sort of simultaneously, but you do need to make sure that the related service staff and school staff have information about that you have gathered and gleaned from your FVE and LMA. I know that you are going to be talking a little bit more in other courses about the functional vision evaluation and your learning media assessment, but I'm going to give you a quick little overview about what that is, what those are. The functional vision is an evaluation procedure that's used to determine how an individual uses his or her vision in functional everyday tasks, everyday life tasks that your particular student is doing. The results are then used to determine the type and the extent of instruction needed, such as compensatory strategies, a need for assistive devices, and environmental modifications. The functional vision evaluation, the FVE differs from the clinical I report, the clinical vision evaluation, and the I report, as it evaluates how the individual really and truly uses and applies their vision in real life tasks such as brushing their teeth or getting dressed or completing their math work in their math class. So it looks at those things in the students' environments as opposed to a clinical setting. Sometimes this testing and the strategies might be similar that are used in the eye doctor's exam and that you use for your functional vision, but the purpose is very different. For example, the doctor might need to determine the need for magnification, where the TBI will need to determine the font size necessary for reading tasks. That's just one example of that. The FVE allows the TSVI, the teacher of students with visual impairments, to make decisions regarding adaptations or modifications needed for further evaluation and instruction. So that's what I was saying a few minutes ago, that you might need to share that information with the other staff members and the family, well, the other staff members that are doing evaluations on your student. And those might be color and or contrast, lighting, size, distance that they need to be from their paper and or the objects that they are viewing. What kind of spatial arrangements might be beneficial for this student when they do their evaluations, and any use of low vision devices that they might need, the student might need. A little bit about learning media assessments. The LMA is a process of systematically selecting learning and literacy media for our students that have visual impairments. That consists of the general learning media, which is both instructional materials, and as listed on here, it could be real objects, pictures, rulers, worksheets, and instructional methods. So it's materials and methods. So the methods could include demonstrations, modeling, prompting. The other thing that we glean from an LMA is literacy media, and that includes a range of tools for reading and writing in print or braille or any other kind of tactile tools they might need. The LMA must include recommendations for the use of visual, tactile, and auditory learning media and other sensory channels. We also need to think about vestibular, proprioceptive, gustatory, and olfactory when we're looking at the sensory channels of our students with visual impairments. And it also needs to include a recommendation for ongoing assessment when it's needed and a determination of the student's primary learning medium. So those are all the things that you're going to include in your LMA. The LMA gathers basically three types of information: the efficiency with which a student gathers information from various sensory channels. So they might use their visual sense more than they use their tactile sense. And in the process of doing the LMA, you're going to gather that information. You'll be observing them in their environments, and you will be able to take documentation and data on whether or not they're using their visual sense or their tactile sense, and often their auditory sense, to gather information in their environments. It also helps you determine the types of general learning media that the student's going to use or will use in the future is using now or will use in the future to accomplish the learning tasks. And again, that's a little bit of information we were talking about on a previous slide. That includes the instructional materials and methods that the student needs. The literacy media the student will use for reading and writing is the third thing on the list of what you are gaining from your LMA. And that's the range of tools that's used to complete reading and writing tasks in Braille and or other in print, Braille, and other tactile methods. One of the other evaluations that you're going to be involved with is the clinical low vision evaluation. Oftentimes school districts have a referral form for a clinical low vision evaluation for a student. And the clinical low vision evaluation is conducted in order to gain information about the student's visual abilities or functioning as they relate to everyday tasks. that could be in, magnification or use of devices. The other thing that the low vision eval could tell us is the non-optical and optical devices and tools that will increase the ease of completing these tasks and help the student complete them more efficiently. Clinical low vision evaluations approach visual impairments from the enhancement of functional vision, typically, how the student is able to use his or her vision in real life tasks, in real life situations. The functional vision evaluation is similar, but it also looks at environmental modifications that a student might need. And it also looks at areas like visual discrimination, looking at color and contrast and clutter. And the functional vision also looks at ocular motor, like fixation and tracking and scanning, and visual motor, such as reaching and grasping and transporting, and imitation. The functional vision looks at visual perception, depth perception, spatial perception, and functional acuity. By functional acuity, I mean the size and distance that the student is needs to best access their environment. For instance, seeing a 3-inch ball from 12 feet. So it's more of a functional kind of functional information that you're going to get from your FVE as opposed to the clinical low vision. This is the book I was talking about a little bit earlier. Essential Tools of the Trade is a fairly new guide, how-to guide for completing functional vision evaluations, learning media assessments, and DCC evaluations. This book was written out of a need for having one book that we could look at to help us complete our functional vision evals and LMAs and ECC docs and ECC evals. This book has a lot of information in it. One of my favorite things about this book is it's called a how-to guide, and it gives you a list of some of the things I was just talking about: the visual discrimination, color, contrast, clutter, ocular motor behaviors. And it gives you the information about what does that mean, what does it mean to visually discriminate, how do you evaluate it, and then it also gives you some recommendations for your functional vision report and for learning tasks. So when you get through with your functional vision and your LMA, you need to share information with your family and other school personnel. Basically, you need to make sure they have an understanding of the eye condition. So depending on the family, how much detail you can give them, but they have to have a grasp of the overview of the specific eye condition of their child. And the school personnel also needs to have that information. General information about visual impairments and interpretation of test results. You could also give them a copy of the eye report, the functional vision, the LMA, and the clinical low vision eval, an O&M eval, and any ECC evals that you have done. You also need to make sure that you give them an explanation of any unfamiliar terms or medical terminology that they might not understand, because a lot of times those doctors' reports are chock full of terms that often people that are outside of our field don't know. They don't know what they mean or how to approach them. You need to give them information about the student's learning channel, that's from your LMA, and give them specific suggestions for modifications of the testing environment and any optical or low vision devices and adaptive equipment that is needed for the evaluations that the other school personnel will do. Let's talk a little bit about other evaluations that could be performed and done with our students. Intelligence tests, adaptive scales, social maturity scales, emotional adjustment scales, and achievement/educational testing. So those are some of the things that our students will also have. Intelligence testing, let's talk a little bit about that, was initially developed to predict success in school. It can be a good predictor of ability to master abstract concepts, and it can provide what might be reasonable expectations for the student's achievement. Provides a single, notice that word is bold, a single measure of information about an individual and their relative strengths and challenges that they might have. Issues with intelligence testing are oftentimes basic concept development is delayed with our students with visual impairment because concept development is impacted by the fact that they have little or no vision. And when you talk about spatial concepts, depth perception, spatial concepts, concepts of size, big, little, concepts of space, up, down, those concepts are often delayed because of visual impairment. Often our students don't have a strong basis of experiential learning, so they're liable to miss a lot of information about things. And what that means is that they might not have firsthand experience at petting a dog or going to the grocery store. So they miss a lot of information in intelligence tests that might show up in intelligence testing. Often verbal development is delayed or different with our kids. They have verbalisms, which mean they could tell you about things and talk about things, but they don't have the understanding of what that means. And their abstract thinking also might be affected, again, because of lack of experiences. They don't have all those experiences in which they can then make those determinations about abstract thinking and abstract concepts. Adaptive behavior skills are basically a collection of conceptual, social, and practical skills, the extent to which a student is able to function and maintain independence within environments and meet personal and social expectations. Just listed on this page are two examples of adaptive behavior skills. The Vineland adaptive behavior skills include subsections of communication, daily living skills, socializations, and motor skills. And the scales of independent behavior for the visually impaired is another adaptive behavior skills assessment. Social maturity scales are designed to measure social competence, and I really hate how this is worded. It's a functional composite of human traits that promote social usefulness. Like I said, I really don't like how that is worded, but I think it is intended to say, can they be self-sufficient? Can they participate with others and help others as well as themselves? The Vineland social maturity scales measure self-help. In general, they measure eating, dressing, locomotion, communication, self-direction, and socialization. One of the other assessments that our students might have are emotional adjustment scales. And these are used to measure emotional disturbance, anxiety disorder, PTSD, or depression. These adjustment scales look at the conditions that impact learning, the interactions with staff and the peers that are going to be around them. Can they express their needs and their wants appropriately? How are they at compromising? How are their problem solving techniques? And can they work cooperatively with others? There are a couple of examples listed there, the WACE-3, the Basque Behavior Assessment System for Children. There's something called the HOC, Sentence Completion Test. These tests will be given by your school psychologist and educational diagnosticians. We'll talk a little bit about academic and educational tests that the general population also uses. They're state mandated assessments like the STAR, which our kids participate in, and the Brigance. They're a number of Brigance assessments. There's an early evaluation for little bitty guys. There's an academic Brigance academic achievement that covers language arts. It covers listening and language arts and math and science and social studies. It's a pretty detailed evaluation that takes a while, but a lot of school districts are used to using that one and they're familiar with it. Key Math is an evaluation for math skills, and it's pretty on target when I have used it in the past. It evaluates just basic math skills. It also evaluates computational skills and math reasoning skills. There are key math evaluations, that key math evaluation that is available in Braille from American Printing House for the Blind. Informal reading inventories are invaluable for our population because they are also used in our learning media assessment process, and they give you information about where a child's functioning in their reading ability, such as word identification, phonics. You can get information about phonics, vocabulary, comprehension, fluency. So informal reading inventories are pretty critical for us to be able to administer as TSVIs to support our learning media assessments. The Woodcock-Johnson is another academic achievement test. So in the Wyatt, it's the Wechsler Individual Achievement Test, the Diagnostic Achievement Battery, and the TOWEL, the Test of Written Language, are all evaluations that we see given to students with visual impairments. And the reason that we need to be familiar with some of these, especially the reading inventory, is that often TVIs are the ones who identify students with visual impairments who are at risk of becoming struggling readers. Classroom teachers may not recognize when students with visual impairments are struggling. So we need to be familiar with our kids' reading ability so we can contribute to that process and contribute to the reading strategies that our students might need. An achievement test is basically designed to measure a person's level of skill or accomplishment or knowledge in a specific area. So a math exam, an example could be a math exam that is covering the latest chapter in your book, or a comprehensive final exam in your Spanish class. Again, we need to see what's going on in those classrooms so we'll know how to support the classroom teachers when they're doing those tests as well. Finally, common problems with many evaluations. Typically, evaluations like the ones I just mentioned, the Brigance and the Key Math and some of those other evaluations, the informal reading inventories, were not written specifically or normed on students with visual impairments. So that could be a problem because of formatting. It also could be a problem. Some of these evaluations could be set up with formatting that our kids aren't familiar with. So we need to make sure we evaluate how they're set up and make sure our students are familiar with that and pre-teach them if we need to do that for formatting. Some of these tests really underestimate the difficulties with low vision. So they don't take into account that our students with low vision might have field losses or they don't know the exact font size when they're given these. That's why it's important for us to know what our functional vision and LMA results are before the other testing is done. The other thing about another problem with evaluations is modifications. Sometimes they don't have enough modifications, and they expect our kids to have some of the tactile skills, like for tactile graphics, that they don't have yet, and so they're excessively modified, and then sometimes they're not modified at all. So again, we need to make sure that we're familiar with the tests that are being used so we can determine if those modifications that are being used on those evaluations are appropriate, that they're not inadequate, or that they're not excessive. And oftentimes the interpretation of the test results is difficult because they're based on kids with visual abilities. They are not specifically written for kids with visual impairments. So the interpretation sometimes is tough, and you need to consult with the people who are given those tests, like the diags or the speech language paths, and make sure that they are being interpreted correctly. So that is all for this section of evaluation for students with visual impairments.